Alrighty, today we're going to be putting on sterile gloves. So we're going to start by putting on some hand sanitizer. You want to rub it in and be sure it's dry. You don't want to try to put gloves on with hand sanitizer still on your hands. Once my hands are nice and clean, I'm going to open this up and be sure it's flat. I want to be sure not to reach my hands over to contaminate anything. I need to flatten it out to be sure it's as easy as possible. And I'll use these little flaps right here to open up the glove. Make sure it's nice and flat. Alrighty, and then you're going to start with your non-dominant hand. You are going to go here, grab the glove by the little inseam, put your hands all the way through, alrighty, keep it here. You don't want to touch the actual part of the glove, you want to keep that as sterile as possible. You will then reach your fingers under the cuff of the next glove. Since this hand is sterile, you're going to take it, put your hand through, and put on the other glove completely. And once you have this glove on, you can then fix this glove, since this hand is also sterile. That is how you put them on. Now to take them off, I'm going to start by pinching the end and completely take it off. I'm then going to cuff right here. I'm going to take these two fingers and put them underneath to not contaminate anything. Completely fold them up. Keep them here to be sure nothing's contaminated. And then throw them away. Alrighty, and now with my sterile gloves on, I'm going to prepare for the insertion of the catheter. So I'm going to start by opening the catheter kit and maintaining the sterile field the entire time. This whole area is sterile. Alrighty, now Mrs. Smith, I'm going to be inserting a catheter as a doctor ordered. If you have any questions or any discomfort, just let me know, but I'll be talking through everything as I do the procedure. So I'm going to start by removing these. I will not be using them. We'll place these drapes on in just a second. The swabs I will use, lubrication, and the flush. Keep that right there, and this right there. Alrighty, so here we have the catheter. We'll pull it out. That's the end of it. I'm not going to actually apply the lube, but for the sake of the demonstration, we'll act as if that is the lube. I'll keep that right here. And now I'm going to put the drapes on, and I need to pull down the sheets, but to maintain the sterile field, would you be able to pull down the sheets for me? Obviously, if in an actual scenario, I would have someone else put on the sheets, seeing as I already have these sterile gloves on. I'm going to go here. Alright, Mrs. Smith, I'm just going to put this right here and avoid it having any contact with you myself. Perfect. I'm going to place this straight as well. Perfect. I'm now going to move this box as it is sterile. Be right here for the procedure. And this bag, a little hazard bag for any trash I need to get rid of. Well, it's there. Here's the flush, and here are the swabs. So I'm now going to start by leaving that right here. I take the first swab, go here, and I'm going to go there, put that away, go here, put that away. Next one, of course, in real life, these swabs would be with iodine and not distilled water. Go right here. Upwards. Away. I'm now with the lube on it, going to put it here and bear down for me as if you would urinate. I'm going to put this about 2 to 3 inches right about there when there's a little bit of urine drainage. Then push just 2 to 3 inches more and move it just a little bit to be sure that it's on there snugly. I would then go here and take off this for the flush. And here. And here. I'm now going to insert 5 milliliters. Alrighty. In real life, I may not, as a little error I might have made, I would not want to take my hand off of the patient once I have, but now that that's there, I'm then going to pull it back out. Alrighty. Alright. Then I can pull that off, put that in there, and that is a catheter. With that, I would now take off my sterile gloves. I would pinch here, completely pull that off, clench it up in a little ball, get my fingers underneath, rip the entire glove off, and that can go in the trash. And just one mistake that I did make prior to taking my gloves off, I should have ripped this off of the patient and then covered the patient up.